The leaders drawn from Kenya Union of Clinical Officers, Kenya National Union of Nurses, Kenya National Union of Laboratory Officers, Kenya National Union of Pharmaceutical Technologists, Kenya National Health Professional Society, among others, had one message.
We wish to ask the government to provide life insurance and a compensation for all healthcare workers who contract or die from this COVID-19.
The unions maintain that their members have been subjected to poor working conditions with minimal protection, evidenced by over 100 infections and death from the contagion. The two health workers who died are from Nairobi and Kajiado, and what's sad, according to the unions, is that none of them have received risk allowance despite the risk they are exposed to.
The negotiation which has been going on between the government and these unions have simply collapsed. I want to note that the government on the table has only been frustrating our efforts to have an amicable solution to the issues we have raised. Ministry of Health has stolen from the dying. It has stolen from the dead. And yet you are transferring these very criminals. So we are saying we are going to issue a fresh strike notice, reawakening the one that we had suspended.
They've also called for the reopening of the economy in phases, saying restriction of movements and curfew has resulted in mental health and security issues, evidenced by the rising crime rate as well as homicide and suicide cases.
Workers are losing jobs in private institutions. All employment has reduced by 50% in this country. We cannot afford to continue losing and knocking down the economy of this country. I am telling you, if you want to have a civil uprising in Kenya, lock this country for another 6 months. We will have a civil uprising. There is no way you can close all bars in Kenya.
Some of the demands include harmonization of allowance from April, employment of 10,000 health workers to handle expected surge of COVID-19 infections, conclusion of risk allowance, and provide life insurance and compensation for all health workers, and the implementation of Health Service Commission.
Let them remove it. But the moment they release that document, we will all cease working, and our duty will be only one: to go and look for the Health Service Commission. The only way you can be able to get enough funding to ensure you have the right ratio is by having centralized human resource management, which can be budgeted direct from the Treasury.
Due to the failed attempts to reach the national government together with the Ministry of Health to resolve issues in the health sector, including risk allowance for the medics, the leaders in various cadres say that this could potentially lead to a very big strike in the country, which will paralyze health functions. Winnie Lubembe for Ebru TV.